Heart disease remains the leading cause of death in America, but few realize the critical role that genetics can play when it comes to our heart health. Now, joining us now to discuss a genetic risk factor called, I'm going to let them talk about it. It looks like LP little a is what it's called, is cardiologist Dr. Keith Ferdinand, along with Susan Riley, a Family Heart Foundation ambassador who has firsthand experience with this condition. Good morning to both of you.
Good
Good
morning.
morning.
Susan, let's start with you. How has LP impacted your family?
Sure. LP little a has impacted my family in many ways. As a spouse, my husband first had heart disease in his early 40s. It was aggressive and we didn't know why, but we wanted it to stop. And then as a mom, I lost my 23-year-old daughter, Catherine, to a heart attack. And it was very difficult for me not being able to help her or not knowing what to do. And then as a patient, after Catherine passed, I learned that I also have high LP little a. And there's a whole host of emotions that come along with getting that diagnosis and then trying to learn to work through the navigation system of the healthcare system. And so I'm dealing with LP little a every day in just about every way.
Sorry for your loss. Dr.
Thank you.
Ferdinand, why is high LP so dangerous and who should be screened?
Well, I agree with Susan. Everyone should be tested, but especially if you have a family member who's had a heart attack or stroke in their early ages, 20s, 30s, 40s, or even 50s, you should have your LPA checked. And it's even more common in persons of African ancestry, Black Americans, and South Asian, but everyone should have their LPA checked. Now, why is that? It's what we call an independent risk factor. That means outside of the things that we already know, high LPA increases the risk for heart attacks, strokes, blockage of the aortic valve, and blockage in the legs. We call that peripheral arterial disease. So you should have it checked because it gives you that powerful information that you have an increased risk for heart disease and strokes. It also tells you, because it's genetic, that everyone in your family needs to be checked, especially first-degree relatives, mother, father, sister, brother, and children. So having high LP little a is a risk factor for these conditions, but it's also a warning sign to other members of your family.
Susan, how are you staying
Yeah.
proactive about your health and what advice would you give to others with high LP?
So first thing is you need to get tested. So everyone should be tested. And if it comes back that you do have high lipoprotein little a, then find a community that knows about this disease and can help you through that. I found that through the Family Heart Foundation, where I learned all kinds of things about lipoprotein A. I learned that there were things that I could do now, today, to prevent getting sicker. I learned how to advocate for myself and for others. I learned the right questions to ask. I learned to find the right doctors. And I learned that there's hope. There's hope that I don't have to live in fear of this disease, that I can learn to live with it.
Dr. Ferdinand, if you have high LP, what can you do to reduce your risk of heart disease and stroke?
Well, we don't have FDA-approved treatments right now. There's research that's ongoing. But if you have high LPA, then you control what we call the conventional risk factors. High LDL cholesterol, lower that. Glucose, lower that, especially if you have diabetes. Control blood pressure, lose weight if needed, increase physical activity, and of course, no one should smoke. So high LPA will tell you to intensify control of those conventional risk factors.
Now, where can we go for more information?
The Family Heart Foundation is a wonderful source. It's a nonprofit. And if you go to cholesterolconnect.org, they will actually mail you a kit where you can check your LPA. And at the website, there's a wonderful amount of information, not only on LPA, but all sorts of heart disease.
Dr. Ferdinand, Susan, thank you so much for joining us on Morning Blend and talking about this important topic. Dr. Ferdinand, I know you went to school, you have your degree, you practice medicine, but I still got to say, Susan, you're a fighter. Thank you.
Thank you. Thank you for that.